Hi, myself Dr. Tanmesh Kumar Sahu. I am a consultant neonatologist and an ICU in charge at Medicover Hospitals, Navi Mumbai. I am a certified lactation consultant, IBCLC. So today in this breastfeeding week, I would like to discuss few important points that will be helping mothers for gaining confidence in continuing their support on breastfeeding. First of all, I would be talking on lactogenesis. Breast milk कैसे बनता है, कब बनता है, how does that secretion happens, कब मदर का फ्लो वॉल्यूम, मिल्क वॉल्यूम बढ़ने लगता है. So basically मदर जब 5th month around pregnant होती है, just around 5th week of gestation, the breast mammary gland starts producing that lactogenesis. That is stage 1 of lactogenesis. Even we can find many mothers who antenatally start producing some colostrum. So this has been a lot of effort in this recent advances of breast milk feeding, is that in US countries they are targeting mostly on antenatal breast milk harvesting. So to give breast milk to their babies and avoiding formula powder to the babies after delivery. So जैसे ये lactogenesis 1, it continues till the post 48 hours after delivery. जैसे ही delivery हो जाती है and the placenta gets separated from the baby, the progesterone level suddenly comes down and this leads to the second stage of lactogenesis, that is when the mother starts having lot of milk output. So to increase the milk output and to continue this breastfeeding support, it is always mandatory for the baby who gets delivered immediately to go through skin to skin contact with the mother if the baby is stable. After doing a skin to skin contact and initially after giving a breastfeed session, the confidence of the mother increases. So the basic point is mother won't be having a good amount of milk volume on the day 1 and day 2 itself, but that latching, what a baby suckles onto the breast of mother, it gives a neurological impulse to the mother and gives a psychological advantage of which the hormone level starts improving and the oxytocin and the prolactin levels increases and the milk output gradually increases. So it is the first most important thing that happens in all mothers, that they feel that their milk output is low and your child is hungry, and for which they switch over to the formula feed, which is completely wrong. So if I say the size of the stomach of a baby who is born on day 1 is just like the size of a cherry, it's almost like 5 to 6 ml only. The volume of the stomach is this much. The colostrum or whatever that yellow colored thick liquid or the chicket wala jo doodh aata hai, that is called colostrum. It is of small volume and it is sufficient enough to feed and make your child satiated. So this is very important to give that colostrum. It contains lot of immune factors, lot of antibodies, lot of lactose and proteins for the child, which is important for the immunity of the child. Secondly, what happens is that from day 2 onwards, when there is a lactogenesis grade 2, the mother starts procuring lot of milk output. And the most important thing what a mother and a baby dad has to do is that they have to allow breastfeeding to continue every 2 to 3 hourly initially. If suppose for example the child has gone to NICU for some conditions, if the child is sick and the baby is not with the mother, and during that time mother can do what? She can express the milk, she can try to pump the milk, she can try to express every 2-3 hourly. So it is the frequent removal from the breast milk that will lead to formation of new milk. जब तक मदर frequently breast expression नहीं कर रही है, milk express नहीं कर रही है, अपने बच्चे को breast feeding नहीं करा रही है, तब तक new milk बनेगा नहीं. Obviously, yes, it's true. Mother is in pain. Mother is in deep pain after a LACS section. Mother is not able to move. Mother is just immobilized for a day. There are a lot of catheters inside, lot of antibiotics going on. But this does not mean that the बच्चे को breastfeeding नहीं देना है. There are many positions like a laid back nurturing position when the mother can sleep just around and the baby can be kept on the chest. So this can be done. A sideline position where the baby can be tried to feed when the mother just take a little करवट बदल के बच्चे को दूध पिला सकती हैं. So 2 things we learned. First thing, frequent breast milk removal, frequent breastfeeding, and most importantly, nighttime feedings are very much important. From night 12 am to morning 5 am, at least 2 to 3 breastfeeding should be tried by every mother, because during this time the level of hormones, the prolactin levels are very high and it helps into continued breast milk expression. Now, when do we say how to support mothers? Because it's very easy in many hospitals to give formula. बस powder लगाया, पानी में घोला, बच्चे को पिला दिया, and thinking that it is equivalent to the breast milk. It is never equivalent. It can never match to the God-gifted human breast milk. So it is always important for the mother, even if for a twin or a triplet baby, a mother can feed on all 3 childs with breast milk only. So when do we actually call is a lactation failure? It is a time when by day 14, mother is unable to secrete at least 500 ml of breast milk per day. This is the time when the mother needs needs a lactation aid. So for any support or breastfeeding groups, we check for the breast anatomy of the mother, we check for the session of a breastfeeding of a mother and a baby diet, we check for good positioning, whether good attachment is there or not. We try to correct those things which are wrong. And third and most important thing, checking the oral anatomy of the child. If the child has a cleft lip, a cleft palate, or a tongue tie, or a lip tie, these are some of the conditions in which the breastfeeding experience should be painful. So the first and foremost question what any healthcare service provider should ask to a breastfeeding mother and her baby is that, is your breastfeeding painful or enjoyable? If the mother says breastfeeding is painful, that means there is something wrong with the attachment, there is some wrong with the positioning. So we need to correct those things. And most importantly, how to continue this lactation. I have seen many mothers who come and start breastfeeding for the initial 7 to 8 days, but they have this complex called PIMS syndrome. What is that? PIMS syndrome is perceived insufficient milk supply. They feel that उनका milk supply कम है क्योंकि milk देने के बाद भी बच्चा रो रहा है, फिर पिलाने के बाद बच्चा रो रहा है. So these are some of the conditions. It's the mother's mentality which needs that to be changed. Is the help of the family support that is required, help of a doctor or a nurse to guide the mother to the feeding, because each mother at an average of at 7 to 10 day of life secretes around 750 to 800 ml of milk that is sufficient to feed at least 3 babies of their own. So this is important. So continuing breastfeeding at least 6 months with a exclusive breastfeeding of 6 months and continuing till at least 2 years of life is what WHO says. So few points which I want to focus with all my topic is that first thing, always the doctors, the nurses, the staffs and the mothers should try on giving skin to skin contact immediately after birth. Secondly, even if you have an LACS or a cesarean section, the child should be attached or latched onto the breast every 2 hourly, even if there is no milk output, because the size of the stomach of day 1 baby is just like a cherry. It goes into a size of an egg by the end of 1 month. So it's not required to fill with the volume like 20 ml, 30 ml feeding volume of formula. Second thing, mother support group. Third thing, mother should be able to feed the child. Nighttime feedings are very much important. And secondly and lastly, mother should be motivated. All mothers should be given a maternity leave for which they can take care of their own child. And parents and father and other family members play a vital role in motivating that spirit of breastfeeding that has to continue for at least 2 years of life. Thank you.